this is a growing area of science and treatment, and we're going to see more of these as time goes on.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. Today, we are joined in our studio at the University of Texas, Dallas, with Ben Isgur, leader of PwC Health Research Institute. The Health Research Institute is a dedicated research group that provides new intelligence, perspective, and analysis on major healthcare-related business issues. Welcome to the podcast, Ben.
Thanks, Bob. Glad to be here.
Ben, you've been with Health Research Institute for over 20 years and have been involved with thought leadership and research initiatives for PwC, and also working as a consultant for many healthcare systems, trade associations, and policy groups. Before we get into some special topics for the benefit of our audience, please give us a broader view of PwC Health Research Institute.
Well, we're basically the think tank within PwC that's charged with looking at trends that are going to be affecting the industry. And those trends could include policy changes out of Washington and the states, all the way to technology changes, operational changes, how we actually deliver healthcare. And we put all that together into, blueprints and roadmaps of the future of healthcare and how it may affect pharmaceutical leaders and life science practices, insurance companies, hospitals, and health systems.
Well, I've been a big fan for many years. I follow you on LinkedIn, and I read a lot of the publications from the Institute. And in preparing for our podcast today, I listened to PwC's Health Industries podcast that you hosted, exploring the top health industry issues of 2020. I believe the topic was return on investment for digital transformation in healthcare. You get to cover both sides of the interview process, giving and receiving. In addition to the podcast, PwC recently published your annual industry report, which highlights the forces that will most powerfully affect the industry in 2020. Tell us a little bit more about that, if you would.
Well, this year we really tried to focus on the explosion in digital for the health industry. So a lot of investment over the last decade, as we saw our health system really digitize, move from a paper-based system to more of a digital and electronic system. And that's kept on moving forward. Now we've got a lot of virtual care, a lot of technology at our fingertips in terms of mobile, and now a large amount of data that's being collected. So we actually themed up this year's report around, are we getting the return on investment that we should be getting for all of this data? And we made the point that many healthcare companies are actually drowning in data but don't have enough insights.
We offer a course in our executive education for doctors. It's the Alliance for Physician Leadership. And medical doctors are the only students involved. We also have a program which is for healthcare professionals, which has a nice mix of doctors and healthcare professionals. And we offer a course that deals with the digital business model, really enforcing the idea that if you do not have a digital business model, you need to start thinking about it because things are changing. So I found that report very interesting, and we'll be sure to post a link to this podcast to that report. I've already sent it to all of our students for downloading, but it's well documented and has a lot of informative information there. So thank you for that. Well, the topic of interest today, we'd like to discover a little bit more on the topic of gene therapy and beyond the hype. And I just want to share with you my introduction to the whole concept of the gene. The book called The Gene by Siddhartha Mukherjee. I read that book, and it was just a great historical perspective up through modern times. And in that book, it was disclosed in 1999, there was a gene therapy that failed, and it was a young guy by the name of Jesse Gelsinger. And they vectored in a solution to help him deal with a metabolic disorder that he had. And the outcome wasn't favorable. And that really set back this whole gene therapy thing about 10 years. And it's a well-documented case. And now today, since then, billions of dollars have been spent. And you guys have put together Beyond the Hype of Gene Therapy. That's a recent document that you've put together. Why don't we start there and try to educate our audience here a little bit? We hear about gene therapy a lot, but really, what is it and where is it going?
Well, that's a great question. And I think, one of the most exciting things about the time and place we are in terms of medicine is the innovation. And, the treatments that are coming out now are not just treating an ailment, but in some cases are actually curative. And I think in gene and cell therapies, that's what we're seeing. And that's why it's such an exciting time to be there. So what exactly are gene and cell therapies? Well, I always give the caveat, look, I am a layperson. I'm not a scientist, a clinician. I really study more of the business of healthcare, which is why I'm on the right podcast for sure.
That's right.
So, what we try to do is really break down these complicated issues so that business leaders can, better understand what we have here. And in a nutshell, these gene and cell therapies are either taking a person's cells out of their body, making a change to them, and putting them back in to treat, or injecting a vector. So making some sort of change to a virus and injecting that back in the body as a way to treat or cure an ailment or disease. So these are very new, cutting-edge types of treatments, very different from what we've seen in the past with drugs that are based on molecules, chemical molecules that are taken in pill or injectionable form in the body. These are treatments that are actually kind of changing, if you will, the makeup of our body to take on the disease or problem.
Yes, I'm glad that you made the disclaimer, and I am not a medical doctor either, but when we talk about the cell therapy, quite often, immunotherapy is the word that's used to describe that. And we look at T cells or white blood cells. And by nature, they're supposed to be able to fight disorders that come into your body. And the cell therapy, this immunotherapy, which there's been a lot of lately, if I understand it correctly, they take those T cells and they re-engineer them and they put new receptors on them and they put them back in your body. And then these receptors basically can go off and target certain cancers. And they've done that pretty effectively. And it's a really a fast-changing area, and it's a very targeted, very specific area as well. Now, comparing that to gene therapy, there's not very many gene therapies in place in the country today, is there?
No, not very many at all. And I think when we talk about gene and cell therapy as an overall category, if we look now about what we have in the U.S., we have 4 approved gene or cell therapies in the United States, one other that's being used in Europe. So a very small number right now. And as you alluded to, these are really super specialized treatments, so a very small population that could use them. Now, that being said, if we look at the pipeline that's going through the FDA in terms of therapies that are looking for approval or through the approval process, then we see some much larger numbers where some would say, upwards of 200 therapies that are in line for approval or going through that process. Not all of them, of course, will be approved, but what it tells us is this is a growing area of science and treatment, and we're going to see more of these as time goes on.
I'm sure it's disruptive in so many different dimensions as well. So when you stop and think of that audience, like one of the gene therapies is for vision, and the audience might be 2,500 people, and the cost might be $1 million an eye.
Yep.
How do you start to deal with that in terms of payment, payers, and providers? It could be very disruptive to the overall healthcare industry. And quite frankly, some of these 200, they might be so good and so successful that they eliminate a number of other providers and what they might be doing. So on one hand, it's like, I know MD Anderson, they want to wipe out cancer. All right. And there's other people that want to wipe out diabetes. And so what do you do when you've wiped out cancer and diabetes? What does that affect the healthcare industry? So this could be very disruptive from that perspective.
Well, it'd be a great problem to have, right? If we wipe out cancer and diabetes, we're probably a long way off from that because there's so many different types of cancer and so many And each person's physiology is so different. But I think you're asking all the right questions. From a business model perspective, what does this really mean for the industry? And it is a bit of a new world. So let's go back, let's try to look at something that's maybe a little bit analogous. So let's just first start on the price issue. 6-7 years ago, we had a lot of new hepatitis C treatments, not gene or cell therapies. These were chemical compound treatments that were extremely effective, but also very, very high priced. But you have to start looking at the total economics of it. So people that have hepatitis C, they're on treatments now without these new innovative treatments. One of the outcomes is they may need a liver transplant, very costly, very disruptive. And so when you start looking at these treatments from 6 or 7 years ago, they were $80,000, $100,000, kind of a whole new level of cost that we had never seen before. In fact, I was doing an interview with someone from one of the business groups, and they had a great analogy, and they said, in the old days, if you were getting your pills together in the morning and one happened to roll off the table and roll under the refrigerator, you would leave it there. When your pill is $80,000, you actually throw away the refrigerator to get to it, right? So we're in a whole nother world here. And that's the kind of thinking we have to place, kind of analogous to these gene and cell therapies. Now, these are not 80 to 100,000. Many of these are hundreds of thousands of dollars and into the millions. And so there's a lot of costs behind that. And so what that means is we're going to have to think of new ways to pay for these. And so we're already starting to see some things bubble up out there for industry. So first of all, people are going to want to see outcomes. So insurance companies, employers, consumers, the government, everyone who's paying for some of these drugs and these treatments are going to want to see some sort of outcome because they're very expensive. Secondly, you're going to want to see different ways to pay for them. A lot of times it's pretty difficult to lay out $1 million, if you're an employer, an insurance company. So we're seeing things like payment plans. Some are called the mortgage model, where you may pay payments over time. We're seeing things where there's an outcome-based payment associated with it. So maybe you break up the payments over 4 different payments. The first one you pay no matter what, but you don't pay the second, third, or fourth unless you're seeing an outcome. So that's just kind of a taste of some of the innovation I think we're going to have to see on the payment side as these treatments come out.
I think I read somewhere, Ben, that Cigna was going to try to charge $1 to everybody that's in the program and kind of a collective fund to help fund the payment of these special research projects like that, because nobody can afford it directly. And the benefit of the general public would be there if everybody contributed a small amount. So there's going to be some innovation that takes place there, I'm sure. So.
Yeah.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
We hear a lot of hype and a lot of hope surrounding gene therapy. When you talk futuristic to your kids and other people in the community, you say, just wait, things are getting better. We're going to find a cure for this. And there's a lot of really high energy that goes into the subject. And you hear about gene editing now, this CRISPR technology. And you say people are going to edit genes, and what kind of ramifications does that have? So I made a note here. I used to be able to tell you off the top of my tongue what CRISPR stood for, and not being a medical doctor, but it's clusters of regularly interspaced short palindromic repeats. And you go, wow, what does that mean?
That sounds impressive.
And it sounds like, well, you can use a little pair of scissors called CRISPR and, cut a gene and insert a new gene or modify a gene. And people start to let their imagination run wild. And what does that mean? You can be an NBA player now, 8'4", or you can design your next generation. From a policy perspective, is there a lot of difficulties in getting this gene therapy moving forward within the government?
I think you're bringing up all the right questions, which is like, how far do we go? And I think right now the focus is really on treatment of rare diseases that we've never had any options for. And so these are really giving people some hope and some options. In fact, some of these are not going to be the first line defense. You're going to try other treatments first before you try one of these. But I think it does bring up the question, and it's not something that we researched heavily in our report around some of the ethical issues and kind of the regulations going forward of, are we going to be able to edit genes just because we would prefer a different ability or capability? The other part of it is, of course, the science. It's very difficult, even though we have the mechanism to edit genes, it's also very difficult to pinpoint what exactly needs to be edited and how. So that is something that is not so easy to do. So I think in the kind of for the near term, we're really going to be focused on these very hard to treat diseases where people don't have any other chance.
We look at our current healthcare environment, and just to navigate it is not an easy task. Electronic medical records aren't commonly shared. We don't have personal information shared the way we want to. There's a lot of analytics being evaluated, new digital technologies that you refer to. When you stop and think about some of the gene therapy, a whole new supply chain, a whole new method. Think about the person who might be going through this process, how difficult it might be to navigate and understand all the different processes, how you get evaluated for gene therapy, and how do you collect information that's needed, and how is this engineered or re-engineered, and how do you get it, infused back into a solution process, and what's your recovery? That whole supply chain of how things are handled, looking at the custody of the information and how the security of the information is maintained, all that really complicates the healthcare delivery.
Well, it certainly does. And actually, we spent a lot of time in our report talking about that very issue. And I mean, it's kind of like, how do you deliver the most expensive pizza in the world, right? I mean, it kind of comes down to that on a most basic level. This is this is a very complicated supply chain. It's a cold supply chain, so it's kind of the opposite of a pizza, actually. But, if we think about, first of all, we have to have clinicians that are aware of it and access to it. So right there, this is something that's cutting edge. There's people going to doctors right now who might not even be aware of that these treatments are available. Second of all, you have geographic issues. So one of the things that we talked about in our report is there's only actually 5 zip codes in all of the United States that have all 4 treatments available in those zip codes. So we're going to have people, consumers, having to travel for these. The third piece is if you're in a therapy where they're actually taking your cells out and then putting them back in, a complicated process. You need to go in to some sort of, provider organization, a hospital, a clinic, or a physician's office, have those cells removed. Then that supply chain custody takes over. It has to be tracked. It has to be kept at certain temperatures to get to the lab or the manufacturing facility where those changes are made. And then all of that has to be reversed, or again, it's kept at temperature. It's tracked. You certainly don't want the wrong cell getting into the wrong person. So everything has to be done just perfectly for this all to work. On top of that, many of these patients are going to be patients that are trying something as a last resort. It's a ticking clock for them. And so you've got that challenge of that and that pressure of, you can imagine parents with a child that want to know exactly where is it along the pathway. Well, I did hear some disturbing news a couple of weeks ago. I read an article about what's happening with our organ transplant programs. And it really brought this to light of some of the challenges that we might see with gene therapies and things like that. Organ transplant programs, we have, documented issues of organs that are sitting on the bottom of an airplane as an airplane is delayed and essentially timing out, not being able to be used. So it just shows you, a lot of this is beholden on the transportation system, the logistical supply chain system, and so it's going to have to be done very carefully.
Yeah, I think the future's here. It's just not well distributed yet. I've heard that stated before. About 10 years ago, I had my genome sequenced. I paid $1,000 for it. That was cheap compared to the the billions of dollars it took early in 2001 to sequence the human DNA. And I got a report back and it was 500 pages, which made no sense to anybody, including my doctor. I wouldn't even show it to my doctor because nobody was intelligent enough to really look at the data and understand the data. And I think that's where we're at now in having people build confidence in new therapies, having doctors that adopt these concepts that move things forward. But it's refreshing to see at least that, we have public awareness and that research is being done and that publications are being made and society is starting to learn this. And it's just not a USA matter. It's a global matter, right?
That's absolutely correct. So, just like the FDA oversees our development of drugs and treatments, there's similar sister agencies around the world. And EMEA has the European Medicine Agency, which does something similar there. There's certainly research and development that's happening all around the globe in these areas. So it's not solely a U.S. innovation. This is going to be something that we're going to be working with countries around the world. So, a lot of excitement there as well. Again, also opportunities for collaboration. And you kicked it off by talking about, the sharing of data and even in our electronic medical records within the United States. Now let's take that up to a global level. And we see certainly the opportunity that can be out there, but also the barriers when it comes to sharing data and information.
So we'll shift gears here a little bit. It's an election year. We won't talk politics, but you know that healthcare is in the news. With your policy background, you have a lot of background related to regulations and policy and really a thought leader along that line. Do you see anything radically different happening going forward? We all want to see a better healthcare system, and there's a lot of different positions. There's a real diverse two ends of the spectrum. What are your thoughts from where you sit today?
Well, the first thing I would say is, healthcare is very important to consumers. And we survey consumers in terms of what they're going to be voting on, and other organizations do as well. And I think, what we see, and I think what others have seen is it always surveys is the number one or number two issue of how someone's going to make a decision about their vote for president and for a lot of elected offices. So front and center as it always is. When you really get into kind of politics and policy around innovation, drug development, even things like we're talking about with gene and cell therapies, often those are bipartisan issues. You don't see as much kind of rancorous politics on them. And, even if we look at the FDA over the last few years, the FDA's had a lot of support from kind of both sides of the aisle, if you will. And implementing the 21st Century Cures Act, which is one of the acts that helped get some of this innovation moving from a regulatory perspective, and moving forward with approval of more generic drugs than we've seen in a long time. So moving those through the process to try to lower drug costs. Again, bipartisan support there. So I think, the one good piece of news is, unlike things like Medicaid and the uninsured versus the insured and health exchanges and kind of our different philosophies out there about, is coverage a right or a responsibility or where does it fit? Innovation tends to be in a little bit of a different category with more bipartisan support. So I would say I have a very hopeful look going forward that regardless of what happens in the elections, we'll still see a lot of support for what we're doing in the U.S. around innovation.
Yeah, there are certain things like transparency. People like to know what they're buying and how much it costs. There's other areas related to surprise billing. Nobody wants to be surprised. And some of these things they're not system oriented. They're really fundamental consumerism type topics like that. From a community and a state basis, are there things that we can do to influence how things are done?
Well, I think so. From a community-wide basis, I see a lot of focus on things like social determinants of health. So, this realization now in the U.S. and frankly in other parts of the world as well, that, we're kind of catching up with the science that actually only about 20% of the influence on our health is the, quote, traditional healthcare system. The rest of it is coming from, our genetics, but also our behaviors and our environment. And so it is something to coalesce around for our community and our state and others, which is we have to address things like nutrition, homelessness, safe spaces where people can go out and exercise. All of those have a huge influence on our health. So I'd also look to that in the new year as an area for bipartisan support.
I call that the NRA. The NRA, and that doesn't stand for the National Rifle Association, but it's nutrition, rest, and activity.
There you go.
Fundamental things. If we can start to ingrain that into the lifestyle of the general population, I think we'll see some really great results. Well, Ben, it's been a pleasure having this conversation with you. We like your thought leadership, your publications, and we're going to try to support and be behind more of your research as we go forward. So we appreciate you taking the time to be with us on campus today.
Well, you're welcome, Bob, and great to be with you as well.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcast or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.